now going to have a look at single carer hoisting from bed to chair. With all of our techniques that we're using, it's important that we've got the risk assessment, the formal risk assessment with the moving and handling plan at the end, and we've read that to know exactly what we need to do. It's also important to dynamically risk assess on the spot as well, so things could change daily. Okay, so we've got the sling in already using the sling sandwich technique. I have already removed the top sheet because we don't need to have the top sheet in because that would be risky having that in between the slide and the patient. With the bottom slide sheet, that can stay in place and actually be quite useful at helping the patient to adjust their position on the bed. With all the equipment that we use, we need to make sure we're doing the safety checks. So we've already done the safety checks with the sling and the slide sheet, making sure there's no damage or rips or fraying. Same with the hoist, which we'll bring in a moment. We need to do our safety checks with the hoist. So from here, if we're going from bed to chair, the moving and handling plan might well suggest to use short shoulder loops and long leg loops. With this particular Oxford Joern sling, what we need to do first is cross the leg loops. From there, we put the hips through the legs. So we're talking about short shoulders and long legs. This will have been assessed by whoever provided it, and the information should be on that moving and handling plan, as I mentioned. So I'm going to do the same thing on the other side, just thread the hips through the leg loop. It's important to remember to keep walking around the bed from side to side, because you don't want to be leaning over the bed to put the straps through. So bringing in the hoist. So I mentioned safety checks. It's really important to make sure that you've done all your safety checks, that the Lola sticker is in date, that the battery has got some power in it, and make sure that there's no damage and that everything's in working order. You might want to do a quick test. It's good to keep communicating with the patient so that they know what's happening and what to expect. And when hoisting from the bed, it's really good practice to get the person into a little bit of a hoisted position or seated position before you actually start attaching the hoist onto the loops. So I'm just going to raise the head end of the bed for the patient. And if you notice they're starting to slide down the bed, you can bring a little bit of a knee break in there to stop that sliding down the bed. And I can keep adjusting the head and the knees to keep the person nice and safe. Okay, it's also important to keep the bed at a good working height for you. So for me, round about my hip height is a good comfortable position. So bringing in the hoist, I'm just going to lower the spread bar down towards the loops, and I'm going to place long legs onto the clip which is closest to the leg end, and short shoulders. Then I'm going to walk around the other side and do the same again, being very mindful of where the spreader bar is at all times. So make sure those loops are nice and secure. With hoisting, there is no set number of people that are required to hoist. It's all down to the risk assessment. There may be occasionally situations where a patient wants their family to hoist them, and therefore it would be an assistance of one, but that does need to be carefully risk assessed. With hoisting, there are lots of risks going on all the time, so there's a lot to think about. So it does need to be very carefully risk assessed. So before I lift the patient in the sling, I would lower the bed. And that makes it much more comfortable, much more secure for the patient. So if they're a little bit nervous or anxious about what's happening, they're in contact with the bed for longer. I'm just readjusting the hoist because it's good to keep an eye on what's happening all the way through and keep adjusting all the way through. You'll notice that the hoist is moving as we're starting the lift, so it's important to keep the brakes off at all times because that helps the centre of gravity change as we're starting to lift. So from here, I want to start lifting in the hoist, and I'm constantly looking at where the loops are. Are you okay? Put your hands across your chest. That's it. So making sure the patient's comfortable all the time, and we should be in a nice seated position. And from there, that's as far up as we can go. Bed down a little bit more as well. Having the slide sheet underneath the ankles is actually a very useful thing because it stops any shearing of the ankles whilst the ankles are moving on the bed as we're lifting up in the hoist. Okay? Yes. So just gently pulling out from the bed in my fab stance. And the slide sheet again is very useful for those feet moving on the bed. From here I might want to come in and just support the feet to bring them off the bed, like so. And we want to try and avoid any swinging in the hoist. From here, just a little rotation around, taking my time, and then bringing the chair in. I'm very carefully manoeuvring the hoist around, opening the legs so that I can bring the hoist around the chair, or bring the chair in underneath the person, which is actually less risky in terms of moving and handling injury. And placing that seat underneath the patient. Okay. And then slowly lowering into position. Checking the position, checking the feet, checking the chair. We've got a little bit of a tilt back on the chair, so I'm just going to readjust it. We don't want that chair to tilt back. So watching the feet all the time, watching the chair. I can also move the hoist if needed. Move the hoist a little bit back and continuing to go all the way down. Careful of that spreader bar. Moving that hoist out the way as soon as I possibly can. And then as soon as I'm low enough to take the loops off, I can then detach the loops. Or, if the patient can detach the loops, get them to do it. Okay, moving the hoist out of the way. Taking the sling away from the patient, you can detach the loops. And then I would recommend rolling back the bottom of that sling underneath the patient's legs, just bringing it out to the side. These slings are good because it's got that nice sliding type of material on the legs. And you can roll them all the way to the back. Okay. And then from there, see if you can get the patient to just sit forwards a little bit, and then you can take the sling